The senator from Oklahoma responded to a question. You're a physician, and you have very well pointed out how the cuts to Medicare Advantage will reduce benefits to senior citizens, how the impacts on the hospitals and the home health care and the skilled nursing facilities and so forth will be reducing services. I'm aware of a June report from the June 2008 report of the Medicare Payment Advisory Commission and MedPAC, which said that 29% of Medicare beneficiaries who they surveyed who were looking for a primary care physician had trouble finding one who would treat them. And a similar survey in Texas showed that in that state, only 58% of the state's doctors would be willing to take a new Medicare patient, and only 38% of the primary care doctors accepted new patients. So my question is, in addition to the reduction of benefits, in addition to the reduction of access to hospitals and skilled nursing facilities and so forth, won't these cuts and the impact on Medicare also represent a lack of ability by Medicare recipients to literally find physician care?
There's no question, to answer my colleague from Idaho, that it will, if it doesn't eliminate the ability, it will deny by delaying the ability. And care delayed is care denied. And all you have to do is read all the tragedies that have gone on in this country for people who have delayed care, which has resulted in a large complication for that individual.
Now, I'd like to raise a point as kind of the accountant around here. You've mentioned some ways that cuts to Medicare are going to pay for this. Actually, there are only two ways that you can pay for a government program. You either got to do it through cuts or through taxes. And I don't think there's anybody in America that believes that you can do $1 trillion worth of new programs and have them all paid for, unless you steal somewhere. And that's what we're doing from Medicare. We say that that's not going to affect Medicare. If you eliminate just the dish payments, which are part of this, it's going to put some Wyoming hospitals out of business. And I can assure you that if those seniors can't go to a hospital in their town, they are going to consider that a benefit cut. They're going to be upset, and they ought to be. Same with nursing homes. If you cut back on nursing homes, the people that have to move to another town for a nursing home, because all of our towns don't have more than one nursing home, puts quite a burden not only on the patient who isn't going to get to see their family as much, but also on the family who has to travel a long ways to see the patient. So I don't think we ought to be paying for the new programs by doing this when Medicare needs an extended life. And I'm always fascinated when they explain that this will extend the life, because yes, if you cut payments to everybody, that maybe saves money and extends the life of it, if we really did that. Is there anybody that really thinks we're going to cut the doctors over the next 10 years, $250 billion? No, we're not going to do that. We never have.
With the senator yield for a moment.
Yes.
Yeah, my one criticism of my colleagues in writing this bill is I think there's money we can save in Medicare. It's called waste, fraud, and abuse. A Harvard professor says at least $125 billion a year in fraud, who studies it. We've had several studies that say anywhere from $100 to $175 billion a year. There's nothing in this bill to eliminate fraud. What we're doing is we're taking care from seniors instead of taking the money from the fraudulent actors in the healthcare system.
Mr. President, if I may say to the senator from Arizona, I greatly appreciate his making this amendment, because there's so much said here on the Senate floor that must be hard for many people to follow. But the one thing that I believe everybody agrees is that there are going to be $464 billion of cuts in Medicare over the next 10 years, period. Everybody agrees with that. I mean, the President of the United States has said that we're going to pay for half this new health care bill with one half from Medicare cuts and one half from taxes. Everyone agrees with that. What Senator McCain's amendment is saying is two things. And Senator McCain, see if I characterize properly your amendment, because it's a very simple amendment. As I read it, it's saying, send it back to the Finance Committee, to the committee, and say, bring the health care bill back without the Medicare cuts, without these cuts to hospitals, cuts to hospices, cuts to nursing homes, cuts to Medicare Advantage, and cuts to home health agencies. And second, if we're going to take money from grandma's Medicare, let's spend it on grandma. Let's take the savings that we find in Medicare and absolutely make sure that we spend it on Medicare, which the trustees have said is likely to go broke between 2015 and 17. Now, did I correctly characterize your amendment? Absolutely. And do you recall a few years ago when the Republicans suggested saving $10 billion over 5 years in Medicare, that the majority leader said that was immoral and that other Democratic senators thought it was awful? If $10 billion in savings to try to make Medicare stronger is immoral, what is spending nearly $500 billion on a new program called?
I wonder if I could ask a question to my colleague from Tennessee. You know, I'm new here, and this is all new to me. I thought the goal here was we were trying to reduce health care costs, and we were trying to provide health care for more Americans. But we're taking money out of health care for seniors to create a new entitlement program. We're taking money out of nursing homes, home health care, hospitals, and a program called Medicare Advantage that people in my state I know enjoy very much. How does it make sense that we are taking money out of Medicare to start a new health care program?
Say, and then I think maybe others could respond. If you're going to spend $2.5 trillion a year, you have to get the money somewhere. And what the Democratic health care bill does is get it three places. One is from seniors, one is from taxes, and one is from the grandchildren of seniors, that is debt. It comes from those three places. And what we heard earlier this week was the Congressional Budget Office saying that the total effect of that $2.5 trillion is that for most Americans, premiums would continue to go up just like they already are. And that for people who go into the individual market, they'll go up even more. They'll go up even more, except there are going to be some subsidies for those people. And where's the subsidy money coming from? It's coming from Medicare. So that's the answer to the question. Well,
it would seem to me, and again, I'm new to this process, that 100 senators would vote for Senator McCain's proposal because everyone in this chamber believes that we should strengthen Medicare. Who could be for taking money out of Medicare if we don't need to do that? I mean, these are really two separate issues. Shouldn't every senator in this chamber say, let's send this back to the Finance Committee so that those cuts can be restored and we can start over and take a step-by-step approach? That only seems fair to me. Perhaps my colleague from Oklahoma could comment on that.
Well, it's I thank the President. We're in trouble on Medicare in this nation. Everybody knows it. We've made promises. The unfunded liability on Medicare is $79 trillion. For us to take $500 billion, no matter what the Enron accounting says afterwards, the fact is we're going to reduce that. We're going to make that worse. Now, we may not make it worse next year or the year after, but we're going to make it worse. And it's going to be worse for seniors, but it's also, like the senator from Tennessee said, it's going to be extremely worse for the seniors' kids and grandkids. Not only have we done that, we've raised the taxes in Medicare on a certain group of people, and we're going to take that money and not put it in Medicare. We're going to take that money and Medicare tax and create a new entitlement. So you're absolutely right. If you vote against the McCain amendment, you're saying you want to cut $500 billion out of Medicare and that it'll have no effect whatsoever on the care. I would remind the senator from Florida, you have 1 million people on Medicare Advantage in the state of Florida. 1 million people that are going to lose benefits under this bill. 1 million people in the state of Florida will lose benefits under this bill.
If I would ask the senator, the senator from Oklahoma, who is a physician himself, one of the effects of cuts in Medicare is to make it more difficult for people who are on Medicare to see a doctor. It's like giving somebody a bus ticket and not having a bus. And I've been reading in the newspapers, for example, in the Washington Post last month, that the Mayo Clinic, which is often held up as an outstanding example of a clinic that keeps costs under control, has announced that it no longer will accept Medicaid patients from Nebraska and Montana, and some Mayo Clinic facilities in Arizona and in Florida are beginning to say no more Medicare patients. Now, is this what the senator from Oklahoma thinks could be happening at other hospitals and centers, even very good ones, such as the Mayo Clinic, where they allegedly keep costs at a reasonable level?
I think that's entirely possible. I don't know that to be factual as of yet. What I do know is we're going to have 44 million baby boomers in the next 12 years jump into Medicare. And we're cutting Medicare. We're going to have 44 million baby boomers jump into Medicare. I'm one of them. And we're going to cut the amount of available funds for Medicare under this bill.
Mr. President?
The senior senator from Wyoming is recognized.
I'd like to ask the senator from Idaho what he thinks will happen with these Medicare cuts as it affects the jobs and the economy. That's one of the biggest things on people's minds right now, our jobs and the economy. And we're concentrating on something here where we're going to maybe make a difference, but even though CBO says it won't be much of a difference.
Well, I thank the senator from Wyoming for that question, because as we've already reviewed here, there are going to be major cuts in benefits in Medicare, in the Medicare Advantage program. There are going to be major reductions in access to Medicare in terms of access at hospitals and skilled nursing homes and facilities and home hospice and other care. But one of the other things that we haven't focused on is the fact that, and it's kind of interesting that today is the big White House Jobs Summit. What's going to happen as a result of these Medicare cuts, in addition to the reduction of access and care and benefits to seniors, is we're going to lose jobs. I've had in my office here representatives of nursing and home health care facilities from Idaho who have told me that if this bill is adopted, a number of those facilities are simply going to have to just go out of business, or they're going to have to dramatically reduce the services that they provide, meaning that the nurses and the other caregivers who work there will no longer have jobs there. And that's part of the way that our Medicare, our senior citizens will lose access, because there will simply be fewer places, fewer physicians, fewer facilities that will take Medicare patients with this kind of an attitude of the federal government toward funding of Medicare. And in the end, what do we have? We have a massive expansion of government, $2.5 trillion, with a massive new entitlement program, along with which comes these incredible government controls over the economy, as well as the creation of a new government insurance company, funded by $500 billion almost of Medicare cuts, $500 billion of taxes, and a massive debt, unfunded mandate pushed onto the states. And that's one of the reasons why I think that the senator from Arizona was so wise in bringing this amendment as the first step in focusing on one of the first fixes that needs to be made to this bill. Let's step back. Let's not pay for a brand new $2.5 trillion entitlement program on the backs of our senior citizens.
Mr. President, how much time is left on
The senator from Arizona is controlling the time, has 3 minutes and 20 seconds.
Mr. President,
Senior senator from Arizona is recognized.
I mentioned the AARP and their support or their opposition to this amendment. I'd like to also point out there's an organization called 60 Plus that has millions of supporters and members, and they also feel very differently than the AARP. Their message is, soon you will vote on the McCain motion to commit with instruction. The motion would commit it to the Senate Committee of Finance, etc. I and the 5.5 million supporters of 60 Plus urge you to support this motion. The Patient Protection Affordable Care Act is nothing of the sort to senior citizens. It would cut Medicare by $500 billion. These cuts would harm seniors who have paid into the program and expected to be there to help them when their health care needs. At 60 Plus, we pride ourselves on advocating for the best interests of seniors, and that is a yes vote on this motion. My friends, let's pay attention to 60 Plus. And again,
Could I inquire of the senator a question?
Yep.
Does 60 Plus sell a supplemental insurance policy to seniors?
I don't believe that 60 Plus sells a...
But AARP does.
AARP does.
It
and
might
obviously,
explain why AARP wants people off Medicare Advantage, 11 million
most
people.
experts on the health care issue believe that this could be a windfall of millions and tens of millions of dollars for AARP if the legislation is passed as it is presently crafted.
Senator from Arizona, how many Medicare Advantage members there are, for example, in the state of Arizona? Is it a small program or a large program?
Our figures are 330 100,000 people in my state of Arizona. And I did notice yesterday when the distinguished chairman of the Finance Committee and the senator from Connecticut were talking, the way that they were disparaging the entire program, how it wasn't any good and about the cost overruns, and it really was a bad program. They've opposed it from the start. And so the message is to 330,000 Americans that citizens of my state who have Medicare Advantage, they're out to get you.
From Tennessee, my understanding is that nationwide, it's about 1/4 of all Medicare beneficiaries. So just about 1 in 4 of all Medicare beneficiaries in America will see their benefits cut. All Medicare beneficiaries will see their access cut. And these problems that we are talking about are not just limited in their impact.
Let me respond again. There are cost problems with the Medicare Advantage. Those cost problems can be fixed, and those cost problems can be brought under control. But the fact is, to do away with the program that allows them a choice in how they receive their care is, of course, again, an effort to have the government make the decisions for people, which is flies in the face of everything we stand for and believe in.
I say to the senator from Arizona, I've heard some of our friends on the other side say the Republicans are scaring seniors about Medicare cuts. Mr. President, not the Republican senators who are scaring seniors about Medicare cuts. It's the Democratic health care bill that are scaring seniors about Medicare cuts, because there are $500 billion of Medicare cuts that will pay for half of this new program, and they're outlined here on this chart as the senators have discussed.